Hello, I am the All-Knowing. Today I will be introducing you to a very important topic when it comes to challenges faced in the world today. It ranges anywhere from analyzing health records to pandemic prevention.
You may be wondering, what is health informatics? Health informatics is the acquisition, management, and use of information within healthcare. This field analyzes the organization and processes of the healthcare system and covers a vast array of issues from the seamless communication among electronic health records to preparing for pandemics and epidemics. With the introduction of COVID-19 in 2019, the health informatics industry is now more important than ever as it has become an integral part of ensuring public health safety in the wake of a pandemic. Speaking of which, pandemics, as we've seen of late, can have a high mortality rate and affect the large part of the population. They typically spread fast and can get out of control in a very small amount of time. In order to ensure public safety, it is very important to develop strategic plans and have systems in place to contain the spread, such as mandating masks. In the graphic, you can clearly see the prevention the mask can do for the public versus being unmasked and allowing high levels of spread. The first step is to look into early warning systems so that we aren't caught off guard and are prepared to handle the situation. Michael Mina, who is shown in the graphic, discussed an everyday surveillance program that analyzes blood samples from hospitals or blood banks that are about to be thrown away for foreign agents that could prove to be infectious. This could be implemented all over the world and help alert federal governments of new, potentially dangerous agents. The immune responses from these tests would allow them to know what is circulating. These technologies exist, but on a small scale. Harvard researchers are working on making this a more robust platform. The next step is to address the issue that health informatics is having in storing and analyzing data in an efficient and unified way. Performance intelligence was developed to combat the lack of monitoring during global health crisis. This will allow the health informatics field to compare data, construct indicators, and identify optimal strategies. The organization of this data will allow for ease of improving and optimizing the various parts of care throughout a pandemic. This will also make it easier to see where the systems are succeeding and where they can improve and what ways they can improve in. A third step can be addressed with vaccines. A major issue faced today in the world of vaccines is creating a vaccine in a timely manner in order to prevent a global pandemic. The future looks bright, though, as a team of scientific researchers cracked the code in developing inactivated vaccines that were worth the pros without the usual cons. This drawback that these vaccines faced was the incapability to make one that does not cause just as much damage to the immune system as it does to the virus. The team developed a way to create these inactivated vaccines without major drawbacks, and that would make vaccines way more effective and efficient. The only issue now is mass production and placing them in pharmacies across the globe. Given the funding and research progression, this seems probable in the next half-decade. The system they are creating will allow for a very rapid creation of a vaccine if a new viral outbreak were to happen.
Thank you for listening about health informatics. Have a great day.